everyone. My name is Ina Khazan, and I'm here with Dr. Ronald Siegel, an international expert on mindfulness and self-compassion for pain and stress-related disorders. He is also faculty at Harvard Medical School and the author of several books, including The Mindfulness Solution, Everyday Practices for Everyday Problems. Ron, thank you so much for speaking with me today.
Thanks for having me.
I'd like to start off with talking a little bit about pain. Chronic pain is one of the most prevalent issues that people struggle with. People, understandably, as soon as they notice the experience of pain, they try to make it go away. And paradoxically, that is the exact wrong thing to do, since the more we struggle with pain, the worse it gets, and the more we get stuck. Could you talk a bit about the cycle of pain and the way that people can get stuck in it?
Sure. You know, a lot of chronic pain disorders are examples of a really broad range of disorders that are recursive in nature, meaning what we do in reaction to the symptom is something that actually ultimately exacerbates the symptom. You know, most psychotherapists are very well aware of this when it comes to anxiety, right? When we're feeling anxious, if what we do, because we want to avoid anxiety, let's say we're anxious meeting people, is we don't meet people, we avoid the party and we stay at home. Well, what's the net result? The net result is we're actually even more anxious because we never gain the confidence that we can get out there and that we can be okay. Insomnia is another excellent example. The harder you try to fall asleep, the more wakeful you become. A lot of people don't notice this, but the same is actually true with a lot of chronic pain disorders. And that's because there are two factors that tend to produce or amplify pain. One of them is muscular skeletal tension, when the muscles tighten up, which we do whenever we constrict or contract in fear or anger or frustration. And the other is that fear itself causes a kind of hypervigilance, which amplifies pain signals themselves. So let me use as an example chronic back pain, because it's a very common occurrence. Let's say we developed some chronic back pain because we started shoveling snow one December and we were out of condition and it started to hurt. If we are so unfortunate as to live in a society that has an epidemic of this, like most developed countries, we're going to start to think, uh-oh, I hope I haven't hurt my back, I hope I haven't injured myself, and the like. And every time we have one of those anxious thoughts, it's going to lead to some, usually, fear or worry, right? And when we experience fear and worry, it tends to constrict muscles. If everybody would just join me for a moment in closing your eyes and just take a moment to exaggerate what fear looks and feels like in the body. Like, just, you know, let your body be really fearful. And, you know, you can open your eyes again. It doesn't take long to notice, wow, we constrict all of our muscles when we're frightened. Now, tight muscles hurt. If we've ever had muscles that tighten up in our neck or our calf muscle spasms, we get a Charlie horse, we know that that can hurt a little or it can hurt a lot. So our sensations of pain increase. And that, of course, is going to amplify our negative thoughts. We're going to start thinking, oh, gosh, I really have hurt myself. This is really bad. And that's going to lead to more fear, more constriction. And sooner or later, what gets added into the fear are anger and frustration. And all we have to do is take a moment to pantomime anger or frustration and realize that, oh, those things too are going to increase muscle tension, are going to increase the problem. Then there's the sort of macro behavioral problem that kicks in. What happens is we start to think, well, I don't want to injure my back further, so we start to avoid activities. We start to avoid sitting or stretching or exercising. A lot of people withdraw from those very activities that had been stress relievers for them, like going to yoga class or going out for a run or a bike ride. And this just exacerbates the situation, and we can become quite trapped in one of these recursive patterns in which actually whatever the initial injury or irritation was, like from shoveling snow, may have long healed, but we are still stuck in this loop in which the pain generates fear and frustration and anger. Those emotions constrict the muscles. Those constricted muscles amplify the the pain sensation, or create more pain sensations, and then we avoid the activities that could have freed us from this. And on top of all this, being in a state of alert hypervigilance amplifies whatever sensations are coming from the periphery of the nervous system anyway. So that's how these things become secular and how we become trapped in them.
It's really quite powerful how in our attempts to, get better, we get more and more stuck in actually making everything worse for ourselves.
Exactly.
Yeah, thank you for clarifying that. So how do mindfulness and self-compassion practices help us get out of that cycle?
Yeah, so what we need is anything that will interrupt the cycle. We'll do it. And there are other methods that aren't mindfulness and self-compassion practices. For example, if you go to the gym and you have a physical therapist that you trust, and the physical therapist tells you you're really not going to harm yourself if you do this, let's just do it. And you do exercises that you thought you couldn't do, and you realize, I'm not actually worse for the wear from doing it. You can pop out of the cycle that way. But mindfulness and compassion practices can be of great support. They don't work so well in isolation. They don't work so well if we're not also involved in some kind of active rehabilitation, excuse me, some way in which we're challenging our fears and rehabilitating our muscles. Because when we start avoiding activity, so often with these musculoskeletal pain disorders, we lose strength, endurance, and flexibility, and we actually produce more pain, more physical pain that way. But the way we use mindfulness and compassion practices and self-compassion practices is by finding a way to open to, accept, and not fight the pain sensations. In the very short run, what that means is it mitigates the vigilant fear, I hate it, how do I get it to stop, and all of that increases muscle tension. But also what it does is it allows us to separate the moment-to-moment sensations of discomfort from all of the impulses to get rid of it, all of the bracing, wincing, and guarding, all of the fighting against it, all of these things that amplify it start to separate out when we're mindful and when we're self-compassionate, when we're able to soothe ourselves in some fashion and basically deliver the message, it's okay, sweetheart. Well, that's also very powerful for relaxing both the pain, the fear response and the anger response. So these things help to interrupt the cycle so that we're no longer constricting muscles so much, and we're no longer fearing the pain so much, and we're able to allow the sensations to come and go more. But again, in my experience, they're helpful but not transformative unless they're also tied to some form of active rehabilitation. And whatever the pain is, in the case of the back, it's about getting medical permission, but then lifting, bending, and exercising. If it's GI distress, it's a matter of getting the okay from a gastroenterologist that you really can eat a balanced, healthy diet, eating the diet, and then using the mindfulness and self-compassion practices to increase your capacity to be with the discomfort that arises. And the same is true across the board with various forms of chronic pain. The key first element, of course, is getting permission from a competent medical professional that says you're not going to damage yourself in some irreparable way if you experiment with living normally. Once you have the permission, then you can use the mindfulness and compassion practices to support your expanded activity.
So it sounds like the main emphasis here is to figure out what does normal life look like, and what kind of normal life do you want to move towards, and then rather than focusing on how do I what do I do with my pain, rather how do I live my life, and at the same time take care of myself when I am in pain, but really the focus is on what do I want to do with my life.
Exactly. We really have to shift our metric from pain relief or pain alleviation to life enhancement. How are we going to live a full life? And when I'm working with patients around this, I ask them early on, what activities have you given up because of your pain disorder? And which of those would you like to reclaim in your life? And it's usually best to start with those that are relatively easy. They don't scare the person too much. And particularly activities that the person can do several times a day. Several times a week. Several times a day is fine too, but several times a week at least, because you don't want to have a setup. Let's say the person feels, well, I can't walk very far because of my pain, and they try walking a little further one day, they're immediately going to be vigilant. You know, how am I doing? Is my back, my leg, my knee, whatever the body part is we're concerned about, is that worse? Is it worse? And that very vigilance is going to amplify the pain sensations, both by tensing the muscles and by focusing our attention on whatever sensations are being generated by the muscles or from joints and other structural parts as well. If we do it several times a week and keep doing it and have as our metric simply building up capacity, sooner or later we're going to have a time when we challenge our body and it's okay. We're not actually feeling substantially worse. And those are the breakthrough moments when we start to decouple whatever the normal activity is from the pain sensations, or when they decouple themselves because we're not so anxious about them, then we start to gain the confidence that we can move forward with this.
So that's really powerful. You know, we're giving up on trying to change that particular sensation, and we are allowing whatever is happening so that we can do what's really important, what's really valuable to us. And you know, one thing I sometimes run into when talking with clients, when talking with other clinicians, is the idea of how do you present this to clients? You know, when you talk with people who are experiencing chronic pain, pain is, of course, incredibly aversive, and usually they're, in your office because they just don't want to be in pain anymore. So how do you talk with them about the idea of allowing their sensations to be, and possibly even finding value in the pain that they're experiencing, which is one of the more fundamental focuses of mindfulness?
Well, there are a few elements or approaches that I find helpful. The first is to absolutely help them to understand that we're not saying or believing that this is imagined or all in their head. Because as soon as we start talking about psychological factors with chronic pain, people think either that you're accusing them of malingering or accusing them of having a conversion disorder and somehow inventing this out of some psychological need. So first, you have to clarify that and say, we're not talking about that. We're talking about ways in which attitudes in the mind and reactions of the mind can amplify or even cause pain sensations, right? And how they change the body in order to do that, how they actually change organ systems. And once you've been through that psychoeducationally a few times to make sure that the person isn't misinterpreting you, because it's an easy misinterpretation, then I get the best results by helping people simply to see how counterproductive fighting the pain has been. It's not so much that they have to value it and think, oh, isn't it good that I have this pain, or how I can learn from this pain. Although I have seen people, once they recover from these disorders, saying, I wouldn't wish it on my worst enemy, but I'm glad I went through it. I really learned quite a bit about working with my emotions, working with my mind, working with my fears from doing it. But I don't typically start with, let's value the pain. Rather, let's see the way in which fighting the pain has been counterproductive. And since you've been fighting the pain for months or years, let's just try a little experiment for a little while, where instead of continuing to fight the pain and see if you can alleviate it, we're going to shift toward this other perspective of regaining your life and using mindfulness and self-compassion practices to give you the resources that you need in order to be able to regain your life.
I really like that. So it's small steps and really allowing the person to have control and to have a choice as to how are they going to do this. And you're really calling up on their willingness to do something different and experiment and see what happens. Thank you. That's really powerful and really helpful. I appreciate you sharing all that incredible wisdom with me.
Thanks so much for having me.